Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Masters in Orthopedic. Today, we will discuss about the pain in the knee joints in the children. The children are more vulnerable to play and get injuries. When they get injuries to the knee joints, the children afraid to tell the parents and they neglect. Such times, children get the joint pains. Following a trivial injuries also, they get the joint pains, but they do not tell the parents, and that leads to there is an accumulation of blood clot and leads to infection and septic arthritis. This is, we see it in a playing children, where we must take care of the joint. Otherwise, the joint gets infection and then it will lead to chronic problem in the life. Apart from this, there is a juvenile arthritis, where the children gets immunological disorder, leads to arthritic changes because of the rheumatoid, which leads to joint pains. And when there is a trivial or major injuries in the playground, the children's joint ligaments, tendons, muscles and the soft tissue of the joint as well as the bony fractures is possible. So, these are the variable knee joint pains happens, and sometimes the children gets tumors in and around the joint. Those are important to rule out. Unusually, when there is a nutritional deficiency causes the rickettsia of the knee joint, where there is a deficiency of the vitamin D, calcium and minerals. Such children who are poor in certain countries, where there is a lot of nutritional problems, leads to rickettsia, otherwise called a vitamin D deficiency problem. So, these are the variable knee joint problems in the children, and we must see whether it is a cause to be ruled out with an X-ray, MRI, CT as well as the certain blood tests to rule out a cause for the knee pain, and then according to the issues we should treat the child. So, rheumatoid arthritis is such a disease in juvenile rheumatoid arthritis, where child will long life suffer with this chronic disease, which needs to be undergo regular lifelong treatment, and sometimes we need to give a local steroid injection to relieve the pain. Sometimes we need to correct the surgeries of the joint which has been affected by rheumatoid arthritis.